Hey everyone, welcome back to the channel. I'm glad you're here, because today's topic is one you definitely shouldn't ignore. Chest pain. Ever felt a tightness or discomfort in your chest, especially when you're stressed or moving about? Well, it could be more than just feeling tired. It might be angina, and I want to help you understand what that really means. So what exactly is angina? Here's the thing. Angina isn't actually a disease. It's a warning sign, a symptom that something's not quite right with your heart, usually thanks to coronary artery disease. Imagine your heart as a busy city, and the arteries are its motorways. If there's a traffic jam from too much plaque building up, oxygen-rich blood can't reach your heart muscle as well as it should. And when that happens, you get pain. Simple as that. The most common culprit here is atherosclerosis. That's a fancy term for fatty deposits lining your arteries. But there are other risk factors too, and they're worth knowing about. High blood pressure, high cholesterol, smoking, diabetes, being overweight, stress, and living a sedentary lifestyle can all make things worse for your heart. Each of these either damages your blood vessels or forces your heart to work overtime. Not ideal, right? Now let's talk symptoms. Angina usually shows up as chest pain or discomfort. People often describe it as pressure, squeezing, or even a burning feeling. That pain might spread to your left shoulder, jaw, neck, or back. You could feel short of breath, a bit sick, sweaty, or just plain worn out. Here's something important. Women, people with diabetes, and older adults might not feel classic chest pain at all. Instead, they could get indigestion, unusual tiredness, or general discomfort. So, don't brush off those symptoms. There are a few different types of angina you should know. First, there's stable angina. That comes on during exercise or stress and usually goes away with rest. Then there's unstable angina, which is unpredictable, and can even strike when you're not moving. That one's a medical emergency, so don't mess about if it happens. There's also something called variant or prinzmetal angina, caused by artery spasms, often when you're at rest. And finally, microvascular angina, which is more common in women and involves the smaller blood vessels. You might wonder how doctors figure all this out. Well, they've got quite a toolkit. An ECG or electrocardiogram checks your heart's electrical signals. A stress test shows how your heart copes when you're working hard. An echocardiogram, basically an ultrasound for your heart, gives a good look at what's going on inside. Blood tests help spot raised cholesterol or heart enzymes, and a coronary angiography uses special dye to find blockages in your arteries. The good news? Angina can be managed. Medications are a big help. Things like nitrates for fast relief, beta blockers and calcium channel blockers to ease the load on your heart, statins to lower cholesterol, and aspirin or other antiplatelets to stop clots. But lifestyle changes are just as important. Quit smoking, eat well, get regular exercise, after a doctor's advice, and work on managing your stress. Sometimes, if things are really serious, doctors might suggest procedures like an angioplasty with a stent, or even bypass surgery. Here's the takeaway. Angina is your heart's way of waving a red flag, but it doesn't have to take over your life. With early diagnosis, the right treatment, and some healthy changes, you can keep living life to the full. If you or someone you know has symptoms, don't wait around, get checked out. If you found this video helpful, give it a thumbs up, subscribe for more clear medical advice, and share it with anyone who needs to hear this. Look after your heart, and I'll see you in the next one.